Rudyard Kipling once said that God could not be everywhere, so he made mothers. And I think that's very true. Mothers are often everywhere, and for the good, for the common good of their children, their families, the community at large.
Canadian obstetrician Dr. Paul Thistle has delivered his share of babies, but he's also seen the dark side of childbirth. Worldwide, 1,000 women die every day giving life. Almost all of those deaths are in the developing world. Some progress has been made by the global aid community to reduce maternal and infant mortality rates. In Zimbabwe, where Dr. Thistle works, the situation is actually getting worse.
We have the unfortunate position in Zimbabwe of seeing our maternal mortality triple in the last 15 years.
He says when a mother dies, it has a devastating impact on those left behind.
They're the center. And if you take away the center of the family household, and it's like a deck of cards, and perhaps that things will collapse. And children don't go to school, children aren't clothed, they're not fed.
The biggest tragedy is that nearly all those deaths could be prevented. As Chief Medical Officer at the Salvation Army's Howard Hospital, Dr. Thistle is one of 3 doctors serving a population of 250,000.
So mothers are faced with the unfortunate circumstance where they fall ill, they have high blood pressure, or they begin to have bleeding conditions in pregnancies and cannot assess medical care. Because their transportation costs or arriving at the clinic or the hospital, they cannot afford the fees. We try to alleviate those fees at Howard, but we still have to charge something in order to cover our ongoing operational costs, or we have to stop providing the service.
Health Partners International of Canada has spent the last 20 years breaking down the barriers by providing one of the most needed resources in the developing world, quality medicine. Their Toronto warehouse is full of boxes of donated pills and treatments. But more than that, each box contains life-saving hope.
In 2011, we sent a record $47 million worth of medicine, which, if you don't want to deal with dollar figures, translates into 3,700,000 patients who received full treatment for the disease they had.
As president of HPIC, Glen Shepherd has seen the need up close. HPIC has a partnership network with 40 NGOs that extends to over 100 countries, including Zimbabwe.
The health of women and the health of children are the key to the future of the country. And it resonates with our sense of social justice. It's a problem that must be addressed.
That's why Health Partners is expanding its focus from medicine to maternal and child health. The strategy has 4 components. Train health professionals with the ALARM course, developed by the Society of Obstetricians and Gynecologists of Canada for underserved rural communities in the developing world. Publish an up-to-date pediatrician handbook for rural communities. Provide mother-child health kits containing vital medicines and supplies to help expectant mothers and newborns. Provide inventory and pharmacy management training to ensure medicines are properly used.
Health Partners is too small. We're not going to solve all the problems of the world, but we can make a life-changing difference for those people who are our beneficiaries.
Dr. Thistle says HPIC's contribution has already made an impact at the Howard Hospital, but more help is needed.
You have to move beyond the emotions of the minute to a vision for tomorrow, a glimmer of vision at times only. So you need to tackle it from all sides and make those little steps, those little changes that may not impact the entire country of Zimbabwe or the sub-Saharan African continent, but will make a difference in the life of just one mother, perhaps a village. You cannot change the world, but you can change the world of one person.